Hello and welcome back, everyone. I'm Abby Phillip, Just the Truth. All right, let's dive straight into the mess. In the Trump White House, foolish ideas seem to spread faster than any virus ever could. Maybe that's why the man in charge shows such obvious signs of mental deterioration. Take the current Secretary of Health and Human Services, Robert F. Kennedy Jr. Here is someone who routinely dismisses trained physicians and researchers, insisting he understands health threats better than they do, yet he appears afflicted by a severe case of bad judgment himself. Worse, he's actively working to make it tougher for Americans to access medications and vaccines that literally save lives. Yesterday, during a conversation with federal health employees, Secretary Kennedy laid out his plan. He declared that his department will mobilize every available tool to dig into why chronic illnesses have exploded across the country. He specifically called out certain antidepressants as one area ripe for scrutiny. He promised to bring together voices from every perspective, no topic off the table, to examine what's driving this surge in long-term health problems. Among the factors he flagged for investigation: childhood vaccination timelines, exposure to electromagnetic fields, the herbicide glyphosate, various other pesticides, ultra-processed foods loaded with artificial ingredients, and, yes, SSRIs, along with other psychiatric medications. This comes right on the heels of an executive order President Trump signed just last week. That order labeled certain classes of drugs, SSRIs, mood stabilizers, antipsychotics, as posing a real danger. Opponents of the order argue these medications are proven lifesavers, especially for severe mental health conditions. Supporters, though, claim they're handed out too freely and come with major downsides. Hold on, let me be crystal clear here. I have close friends battling serious mental health challenges every single day. For some, antidepressants are the difference between functioning and falling apart. For others dealing with bipolar disorder or similar conditions, these drugs can prevent catastrophic outcomes. So when I hear the nation's top health official question them so aggressively, it lights a fire in me. You'd hope the massive uptick in dangerous measles outbreaks, check our previous reports if you haven't already, might force him to pause and reconsider his stance. But no, like virtually everyone else in this administration, Secretary Kennedy shows zero willingness to reflect or admit when evidence points the other way. Common sense? Not on the menu. And now he's right in the middle of a scandal that feels like the perfect summary of every reckless, head-scratching decision he's ever made. It happened during a recent sit-down with comedian and podcaster Theo Von. What came out of his mouth has sparked a whole different kind of drug controversy, one that's equal parts shocking and ridiculous. Listen to this exchange. They were reminiscing about early morning recovery meetings they both attended years ago, held above a bank. Those got shut down during the pandemic, which devastated a lot of people in recovery. But Kennedy and a small group, about 15 strong, refused to stop. They relocated to a theater space that later burned in a wildfire. He described it as a kind of renegade gathering. He told Vaughn point blank, no matter what, he was committed to attending a meeting every single day. He wasn't afraid of catching a virus. Why? Because back in his using days, he routinely snorted cocaine right off toilet seats. He knew addiction would destroy him if he didn't stay vigilant. For him, daily meetings were non-negotiable survival. Plus, the chance to support another person in recovery, that's the real power keeping everyone sober and out of self-destructive patterns. So there it is. The Secretary of Health and Human Services, the man now overseeing national drug policy and public health guidance, casually admits he used to snort cocaine directly off public toilet seats, and that's why he felt bulletproof against COVID germs. Let's unpack that for a second. I've spoken with plenty of people who've fought substance use disorders. I've read countless stories from those who've been through the worst of it. But using a toilet seat as a surface for cocaine, that's a new low even among the darkest tales. You'd think, given his current push for tougher drug enforcement, look at our coverage on the Venezuela-related crackdowns, he might want to outlaw public restrooms altogether. But the real outrage here is the tone deafness. Millions of us lived through 2 brutal years of the pandemic. Families lost loved ones, young people, healthy people, cut down by COVID, survivors still deal with lingering damage, and the person now in charge of our health agencies brushes off the danger of infectious disease by bragging about past toilet seat drug use. It's not just tone deaf, it's insulting to everyone who suffered, everyone who lost someone, everyone who trusted public health guidance, when overwhelming scientific evidence and medical consensus show that vaccines prevent outbreaks and antidepressants help millions manage life-threatening mental health crises, yet he dismisses both while floating fringe theories? That's not leadership. That's dangerous. If I ever cross paths with him, I might have to aim straight for wherever that infamous brainworm used to live, but credit where it's due, he's brutally candid. Next time he drops another baffling statement and we all wonder, what on earth is that man on? Well, now the answer's clear. Cocaine, toilet chaser. It explains far too much. Hello and welcome back, everyone. I'm Abby Phillip.